Hi everyone. In today's clip, I will talk a little bit about diverticulitis. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So diverticulitis is a condition where small pouches in the colon called diverticula becomes inflamed or infected. These pouches can form when sort of weak spots in the colon wall bulge outward. Now, usually due to pressure over time, a condition called diverticulosis then is going to come about. So most people with diverticulosis never even develop symptoms, but when inflammation or infection happens, it becomes diverticulitis. Now, risk factors include low-fiber diet, obesity, and altered gut microbiome, as well as microtrauma or microperforation in diverticulum, followed by inflammation, chronic low-grade inflammation, and mechanical factors like hard stools or constipation. Standard medical treatments for acute, uncomplicated diverticulitis is that it is historically treated with broad-spectrum antibiotics and a liquid or clear fluid diet, although recent evidence sort of suggests antibiotics may not be necessary in many uncomplicated cases. They also suggest bowel rest or clear liquids, basically, pain control, and close clinical monitoring of the typical sort of first steps. One major issue revolves around the antibiotic therapy. Aside from the regular side effects such as gastrointestinal upset, allergic reactions, antibiotic resistance issues, the major issue is that they disrupt the gut microbiome that not only causes diarrhea and other conflicts, it also goes against the very thing that the patient needs at the time, which is healthy microbiome or friendly bacteria. For complicated diverticulitis, which may include abscess, perforation, fistula, or obstruction, this often requires hospitalization, drainage procedures, or even surgery. There are two types of surgeries, one being primary resection with anastomosis, which is removing affected colon and reconnecting healthy ends, or Hartmann's procedure, which is removal with temporary colostomy. The potential complications of the surgery can be surgical site sort of infection, bleeding, leak at the reconnection site, which can become life-threatening, and also bowel obstruction, prolapse, skin irritations, diarrhea, urgency, or incontinence. So growing evidence on the role of the gut microbiome and inflammation has prompted researchers into understanding probiotics and inflammation modulating therapies, but definitive clinical recommendations are not yet established. So from the orthomolecular or nutritional perspectives, few nutrients are considered the framework and are linked to gut health mechanism, such as vitamin C to help strengthen colonic connective tissue, omega-3 fatty acids with anti-inflammatory effects, probiotics, which is beneficial bacteria to help restore microbial balance and reduce inflammation and pathogenic bacterial load. Vitamin D3 and K2, MK7 type for immune regulation and reduced inflammatory bowel activity, and antioxidants like vitamin E and niacin. So orthomolecular medicine approaches involve megavitamin dosing, far above recommended daily intakes, basically. Historical medicine addressed intestinal disorders, inflammation, and bowel dysfunction more generally with a humoral theory. As I have mentioned in my previous clips, we have 4 humors in the body: blood, which is warm and moist, yellow bile, which is warm and dry, black bile, which is cold and dry, and phlegm, which is cold and moist. These are called also our temperaments. Intestinal conditions are often contributed to things like distemperament of the bowel, dry stool, cold, dry internal states, and excess or corrupted humor or fluids, which might roughly translate to concepts like chronic constipation or improper digestion. So healing includes dietary regulation, herbal compounds, enemas, and lifestyle adjustments tailored to the particular temperament and the observed symptoms, of course. So dietary modifications, for example, include fiber management. High fiber helps prevent future episodes, but fiber supplementation in acute diverticulitis is not recommended until inflammation settles. During flare-ups, a clear liquid diet allow bowels to rest, and later gradual reintroduction of low residue foods as you can tolerate it. Natural compounds with anti-inflammatory effects include curcumin or turmeric, which is anti-inflammatory, boswellia, which is similar anti-inflammatory potential, ginger, which with mild GI anti-inflammatory effect, herbal teas like chamomile and peppermint, and definitely avoid stimulant laxatives like Stena or Cascara Sagrada during acute episodes, as they can worsen cramping and inflammation. And plenty of probiotics in food and supplement format to support general gut health and reduce inflammation. On the emotional and metaphysical side of things, emotional stress and unresolved conflicts are one of the main causes of this particular ailment. Hope this has been helpful. My clips are also available on Rumble, TikTok, and YouTube. Like, share, and follow for more. Be the light.